From ancient Mesopotamian midwives to Renaissance surgeons, the practice of tying and cutting the umbilical cord has protected newborns for over 2 millennia. Globally, with about 40,000 babies born daily, we talk about the most utilized practice in the field of obstetrics. The amniotic sac, a double-layered, fluid-filled membrane, forms early in gestation to cushion, hydrate, and protect the developing fetus. With sterile fine scissors, carefully slit the sac's outer layer to reveal the baby, the attached placenta, and the life-sustaining umbilical cord. The cord itself contains 2 arteries that carry waste away from baby, and 1 vein delivering oxygenated blood from the placenta. The surgeon may spot the fine downy hair on areas like the hands and shoulders, an otherwise unusual but perfectly normal finding. It's called the lanugo. Next, the medical personnel inspect the placenta for completeness, look for uniform thickness and no missing lobes, and examine the cord's Wharton's jelly, that protective gelatinous sheath. 2 sterile clamps are positioned on the cord, spaced about 5 centimeters apart. This is the World Health Organization's recommended distance. Using a clean scalpel or surgical scissors, sever the cord cleanly between the clamps. Gently squeeze the cut end toward the baby to express any residual blood and amniotic fluid. Tie a secure ligature at the base with sterile cord ties. The face is cleaned, especially the nose, to allow for breathing. At home, keep the stump clean and dry. This millennia-old procedure remains essential to newborn care and infection prevention. Shout out to all the doctors, nurses and healthcare professionals that ensure our babies are safely delivered.